So we know from numerous prior studies that TP53 alteration, and particularly TP53 mutation, is associated with very poor prognosis in mantle cell lymphoma. And attempts to overcome this with more aggressive chemotherapy, autologous transplant, have really not been very successful. So some of the attempts that investigators have looked into to try to achieve long-term remissions in this population include allogeneic transplant and CAR T-cell therapy. And so we wanted to look specifically at this TP53 altered population across many institutions to see if we could get any insights about whether these more aggressive approaches could achieve long-term remission in this high-risk population. And so we looked at the overall TP53 mutated and deleted and overexpressed population with a total of 254 patients. And then we looked specifically at autologous transplant, allogeneic transplant, and CAR T-cell therapy. In terms of autologous transplant, we did see an improvement in event-free survival for the overall population that was associated with autologous transplant, although when we looked specifically at the TP53 mutated population, we did not see a benefit, and there was no overall survival benefit in either the total group or in the TP53 mutated group. And we know that the patients with TP53 mutation particularly are the highest risk. In terms of allogeneic transplant and CAR T-cell therapy, both of these had pretty short event-free survivals after treatment. So for allogeneic transplant, it was just 1.5 years. And for CAR T-cell therapy, it was just 0.9 years. I think that the caveat here is that these patients were pretty heavily pretreated. So it remains to be seen whether, particularly with CAR T, early incorporation of this strategy may be more successful, because I think that with TP53 mutation, you have a tendency to develop other mutations over time and have clonal evolution, particularly with chemotherapy. And so it's possible with a non-chemotherapy approach up front, followed by CAR T-cell therapy, that you may see better outcomes than what we saw in our study.